Like and subscribe for daily OT brain boosters. A client with an intellectual disability is learning a work routine at Goodwill and needs help with clocking in, putting on a name badge, and starting to sort donations. Therapist teaches the client to complete clocking in first, while assisting with the remaining steps, then plans to teach the next steps in order. Which intervention is this? B. Forward chaining. An older adult with an intellectual disability living in an ILF depends on her parents to do her laundry. Her therapist wants to help her become more independent with this task. Which intervention would be most appropriate? A. Use forward chaining to teach the laundry task step by step, beginning with the first step in the sequence. An OTR is selecting a wheelchair for a client who had a right transfemoral amputation and a left upper extremity fracture that is non-weight bearing. Client will use a manual wheelchair for mobility at home and plans to propel it with the unaffected leg. Which wheelchair feature would be most beneficial? B. Low seat-to-floor height. Context: low seat-to-floor height. This allows the client to reach the floor with the unaffected leg and propel the wheelchair using foot propulsion. It is best when arm use is limited, and the client must rely on one leg for mobility. An OTR is selecting a wheelchair for a client with a T10 spinal cord injury who has full upper extremity strength and will independently propel a manual wheelchair throughout the day. The therapist wants to improve propulsion efficiency and make the hand rims easier to access. Which wheelchair feature would be most beneficial? A. Offset rear axle position. Context: offset rear axle position. This moves the rear wheels forward, making the hand rims easier to reach and improving propulsion efficiency. It is best for clients who have good upper extremity strength and will self-propel with their arms. Like, comment, and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.